Welcome to this week's Wellness Podcast. Today we have Gina Tulimero. She was born in Las Vegas and has a rich history in orthopedics. And currently you're a teacher at Touro University, correct?
Yes, that's right. Yep.
So what drew you to orthopedics to begin with?
I grew up doing competitive gymnastics. So I've known that I wanted to be a physical therapist since I was 10 years old. I had a friend in gym at the time that she actually suffered a pretty traumatic injury. She was tumbling forward and she did the number one thing that you're not supposed to do is put your hands down, right, when you're falling. And she broke and dislocated both of her elbows at the same time.
Oh, wow.
So it was in the 90s. It was like the era of the Beanie Babies. And I remember trying to keep her distracted while they were trying to get her to the hospital. And she ended up having surgery and they did an ORIF. So they did the rods and the pins in both of her arms. And she's 11 years old at the time. And they had told her, she could never go back to gymnastics. Like there's no way that her body could take that again. And she did physical therapy. And a year later, she was back out on the competitive floor. And I was so proud of her and so happy that she was able to get back to doing what she wanted to do. Yeah. And when I was 10 years old, I was like, I want to be that person.
Wow, so you were hooked. So
I was hooked, yeah.
You've been doing it a while. How has your perspective as far as wellness has gone, evolved over time?
So in healthcare, we kind of say we're always these like lifelong learners. So I would say how it's evolved is I always feel like it doesn't matter how many degrees I get or how many like certifications I kind of accumulate. I don't think I'd ever rank myself as better than like 85% in terms of like knowledge of job. Because there's always something that's evolving and there's always something new to add or new to learn. There's always new techniques. Research is always coming out with, new data or new recommendations for certain things. So it's kind of like this ever-evolving profession, which is why I also really enjoy it so much, is because it's never stagnant.
Yeah, and you deal with people in pain a lot then, I'm guessing.
Oh, yeah.
Right?
Yes.
So how do you manage that and how do you help them get through that?
It's a lot of education. So I think a lot of the times, most often people are coming to us and it's maybe like one of the first times they've ever had a traumatic experience or an injury that has either taken them out of their job, out of their sports. I treated a lot of athletes just because of my background. And so I think a lot of it is that there's that component of fear and just not knowing, right? Think of like the first time you've stepped into a hospital and you see all of the wires and the beeping and you don't know what anything is, and it can be really anxiety provoking. So I think the first thing to start with is just educating the patient. This is the procedure that happened, or this is what the surgeon did. This is how long you're expected to be in recovery, and just kind of making sure that you understand everywhere, like every phase that they're in, every step that they're in is what's to be expected, and that you can educate them so that they just have a little bit more awareness and understanding. And that helps with a lot of it.
Yeah,
it is scary.
It is scary.
Yeah.
I'm in that situation right now, so I can tell you. And then you're leaning on the therapist for hope.
Yeah.
Because it's a process.
Yeah. So I think a lot of time it's a lot of that unknown. So especially if it takes you out of like your job or if it's your dominant extremity, it changes how you do everything, right? So I would start with saying education is probably the number one thing for the pain.
And they have to do it at home as well, right?
Yeah. So we typically send people home with home exercise programs, things that they can do like morning, noon, and night, just depends. Not all of our patients are surgical. Not every PT treats outpatient orthopedics settings. So it varies a little bit from like setting to setting. But yes, in the outpatient orthopedic, we do send them home with things that they can do just to kind of make sure that their progress is still moving forward.
And is there any general mobility exercises that you recommend for people just to keep their body to prevent from having to go to physical therapy?
Oh, any type of movement. We always say like motion is lotion. So I would say don't underestimate walking, like how important walking is, especially for women.
Okay.
I would say stretching. A lot of people focus on just bicep curls or whatever it is that they do at the gym, but we don't function in one plane. We function in like different planes at the same time. So keeping your workouts a little bit more functional in terms of movement, and of course stretching and mobility.
Yeah, that's the biggest thing, right? Because you go to weights and you're getting bigger muscles, but you're not doing that functional.
Right. Or balance. That's another one too that I think that a lot of people overlook. And that's something that we often have a hard time with. As we get older, our proprioception decreases, our reaction time decreases. You always hear about, oh, my grandmother fell and broke her hip. So it's things like that. Balance is one of those things where if you truly don't use it, you lose it pretty quick.
And so from an educational standpoint, what is functional? What is a functional movement?
A functional movement, so like squatting down and picking something up off the floor, reaching overhead. So a lot of movement, like coming out to the side, we typically don't reach for things out to the side, right? We reach for them this direction, so where we can see them. So I think just kind of correlating it to whatever your job, your profession, your sport is, that's functional. So it's whatever's functional for that person, whatever they need to do to kind of like get through their day.
Okay, so not only just sports, just literally.
Literally anything, yeah. So like, we live in Las Vegas, so blackjack dealers, this is functional for a blackjack dealer, right? That's a functional movement for them.
I see.
Maybe not as much for everybody else in terms of like how often they're having to do that, but it's more tailored to that profession.
And mobility, so what's the difference, function and mobility? Are they two different things?
Yes, they're two different things. So every joint in our body should have a good combination of strength and mobility. And if one of those is lessened or decreased, then you're more at risk for injury. So mobility would be like moving your hips. We call them cars, which is like hip cars, so kind of controlled articular rotations. Same thing with the shoulder, just moving it through the full joint before you do any type of like really strenuous workout.
And is it like a move it or lose it kind of a thing? Like, would you
Kind
start
of,
losing
yeah.
mobility over time
Yeah,
if you're
absolutely.
not using it?
Yeah, absolutely.
Okay.
Yep.
Do you have any tips for mobility exercises for people? Like at
Oh
home?
my goodness, there's hundreds.
Tons.
Tons
Okay.
of them.
Yeah.
Tons
Because
of
most people they don't really even understand like how ankles, for example.
Yeah.
Like how do you keep your ankles lubricated?
Yeah. Well, the ankles is actually that's a fairly easy one to do at home, especially if somebody has stairs, because you can hold on to your handrail and just drop your heels off the end. And then you can do it with one knee straight and one knee bent, and you'll get both muscles that are in your calf. So that's an easier one. It's usually the hips that are a little bit more difficult, require you to get kind of on the floor, do things like that. Same with the shoulder too, to go against gravity. So.
But it doesn't sound like you need a whole bunch of equipment. So like
No.
people are able to do it if they
you don't need any equipment for it. Yeah.
Okay.
Yeah.
And I know you had mentioned when we were talking about the Nevada
Healthy Performers.
Healthy Performers.
Yeah.
Can you tell us a little bit about that?
Healthy Performers Nevada. So I just joined last year. I'm on the board for them, and we are a nonprofit organization. We started actually about 7 years ago in Northern Nevada, and we're a group of MDs, PTs, some athletic trainers, and our main goal is to promote the wellness and health of our artists that are here in Las Vegas.
Okay.
So our Cirque du Soleil artists, our aerial artists, dancers, gymnasts, even our musicians. So we actually just they've done about 7 now up in the Reno area, workshops. And we just did our first one here in May at UNLV. So
that's exciting.
it was a lot of fun, yeah.
So is there a difference between their wellness and an average person's wellness?
It's just more tailored to what they have to do.
Okay.
And it's interesting because, so I grew up in like a gymnastics background, and I would treat a lot of gymnasts, but then I would still get, ballerinas every now and then. And we speak similar languages, but not the exact same language. So I think it's more of promoting an understanding of what's important for that discipline versus what I may be just familiar with from gymnastics. So it's a great networking opportunity, and it's one of those things where the more your team, really like your PTs, your MDs, the more that they communicate, the better outcomes that athlete or that patient will have.
And why do you feel like PT is critical in someone's healing?
I think it's critical even before that too.
Okay.
So we do a lot of injury prevention as well. So we do a lot of screenings at the workshops that are specifically tailored to gymnasts and dancers. So we're looking for things that we've recognized as patterns that are maybe a little bit more of risk factors in these athletes. So PTs don't just do like post-op surgical stuff. We do a lot of kind of work on the front end to mitigate that risk as much as we can.
And posture, is that included in that?
Posture is huge. Oh my goodness, yes. I'm always looking at posture, especially with like any upper body type pain. So I'm looking at, how do you sit at work? What do you do for work? How often are you sitting? How much are you getting up? Are you reaching? And that's actually another area that I think people don't realize PTs work in, is that we do a lot of ergonomic assessments. So PTs can be hired by major companies. Like I have a classmate that I think she did it for Google and was up in Northern California and was assessing all of their desks to make sure it was at the right height, to make sure their elbows are rested properly so they're not kind of slouching, they're not looking down too much, their monitors at the same like eye level. So there's a whole bunch that PTs do on the front end to kind of mitigate that.
And is posture a DNA thing, learned behavior, or like why would someone get out of posture? Like,
I think it's more of a learned behavior. I don't know if there's a scientific answer to that. I think it's more of an awareness. So even when I have patients and I just see them, like my little gymnasts, they'll kind of laugh at me all the time because I'll just cue them. I'll just like tap the front of their shoulder, and they know I'm telling them to sit up taller.
Oh.
I've even had patients where if they're like working at a desk all day, I'll say just put an alarm on your phone or a Post-it note on your computer that tells you stand up every hour or something like that, just to kind of like make you aware of it so that you can work on it.
Yeah, it sounds like a habit then.
It's like it's like a habit, something to work on. Yeah.
So any practical habits or practices someone could do at home to make sure they're preventing these kind of injuries?
Which kind of injuries?
Well, well, any kind, I suppose. I mean, most people complain about shoulders and knees, right?
Yeah.
That's what I hear a lot because I'm a personal trainer. And it's mostly the knees that they come in or their shoulders.
For knees, I would say flexibility, making sure that they're staying flexible. For shoulders, I think posture is a really important one. So a lot of something that people don't realize is like if you sit up tall, like I'll bring this arm up over my head, right?
Yeah.
But if I slouch down, I've moved my scapulas forward, and it's literally that bone is now going to block my humerus for coming up. So I physically can't go up.
Oh, wow.
So if you have somebody that does have pretty poor posture just in sitting, then they are going to be more inclined to develop any type of like rotator cuff pathology, impingement type syndrome, anything underneath there.
So it doesn't have to be an accident that happens that you start getting an impingement.
Absolutely not. No, it doesn't have to be like a traumatic event. A lot of times, actually, we're seeing now, speaking of rotator cuff tears, we're seeing now that they're more degenerative than they are of like an actual, I fell up while I was skiing, like a traumatic event.
Yeah, and we have cocktail waitresses here too, right? And dealers.
Hairdressers do a lot because if you think of like having their arms up all the time. Yeah.
So is there a counter activity you could, like say you're a hairdresser and your hands up all the time? What would be a counter activity for that?
Yeah, like stretching. So you always want to do like the opposite, right? So if you're always coming forward, you want to go back. So I would say pec stretching would be great. Just putting your hand maybe against the wall and kind of leaning your chest forward so you're opening up the front of your chest. Strengthening your scapular muscles, so the muscles that sit in between your shoulder blades, making sure that those pull back as well.
So is that a general rule of thumb? Like do the opposite of whatever the activity is you're doing?
Typically. Yeah, typically.
Obviously, every case is individual, but like as an example.
Yeah.
So are there any newer technologies or advances that you'd like to share with us that are different from what they were before?
Yeah, I think concussion screens is a really prevalent thing to do now. So what we do is actually do it with a group of high school athletes. We establish a baseline like concussion screen for them. So these are your athletes that are typically going to be in contact sports, not necessarily contact sports, but have high chance of falling or hitting their head on something.
Okay.
So what we do is we look at their visual acuity and their balance. We have them do a cognitive test as well. So how quickly can they do, math equations? How quickly can they recognize patterns? And then we score them so that they have their baseline. So when they go to play their sport, if they do get any type of injury, we know when it's safe for them to go back to play because we can compare where they're at now and to what their normal is.
So like CTEs, I've heard that with football.
Oh, absolutely. Yeah. So football, basketball, volleyball, cheerleading, because they go up so high and fall, they can fall. Same thing with gymnasts too. So even though it's not technically a contact sport, anything where they're at risk of any type of head injury.
And that can happen in any sport. Like my friend just did it.
Oh my gosh, that can happen going down the stairs. Like, yeah, absolutely.
So they used to recommend just staying awake so that you make sure someone's with you to make sure that nothing happens to you. Is that still accurate?
Yeah, they actually recommend now they want your brain to rest. Yeah.
So sleeping is okay afterwards. Obviously, seek a professional first. Like
100%. Yes. So of course, with any head trauma, you want to make sure that you're being treated by a professional. But then you want to kind of slowly go back. If it's a student athlete, for example, you want to slowly progress going back to even sitting in a classroom again, because that's a lot of strain on your brain after an injury.
Well, that's great. They now have a technology to monitor that.
Oh, it's so cool. They have, everything's on an iPad or an app now, right? So the student has their profile and they can go in there and they update it typically. Like we usually will do it with the freshmen and then the juniors. So that way it's getting updated every couple of years so that they know what their normative values are.
Perfect. Yeah. So how can someone tell the difference between a minor ache and something that really needs more attention?
Yeah, especially if it's like not from a traumatic injury kind of situation. I typically advise my patients to follow the rule of threes. And again, I work with a lot of younger athletes, or I did when I was full-time in the clinic. So the rule of threes is if it's more than a 3 out of 10 on a pain scale, if the athlete or patient or whomever complains about it for more than 3 days, or if it pulls them out of their activity for 3 days. And again, this one's a little bit more tailored to the adolescent population, but if it's within like 3 inches of their joint line, then I would send them to get assessed.
Okay. Yeah. And then what would you say is the biggest misconception about physical therapy?
The biggest misconception, I think it's that we can fix you in like 2 visits. I think that's a tough one. Things take time, especially when they're more chronic situations and there's multiple body parts that are involved. I would say, PTs we get this like, oh, physical terrorist. I don't know if you've heard that.
I haven't heard that yet, but I can see why they say that.
No, it's a lovely name.
Yeah.
But I think the misconception is that, not like, I really don't like that phrase that we all heard as kids growing up, no pain, no gain. I think your body, you are experiencing pain for a reason, and it's trying to tell you something, right? So not every visit to PT should be extremely painful. We're not here to cause pain. We're trying to improve mobility. We're trying to decrease pain, even though that's sometimes, it's like, oh, this was a really tough day today.
Well,
but yeah, I would say those 2 are the first ones that come to my mind.
And from personal experience, I think the thing I struggle with the most at the moment is when do you push and when do you not push? Yeah. Because like if you're having pain, but you need to push to stretch it out or whatever, but what's too far?
Right.
Like that seems to be...
And that's kind of where that education comes in too, right? So it's kind of making sure that you understand, and not everybody comes with a sports background, so not everybody knows the difference in pain, right? They could be using the word pain, but maybe they're just sore, or maybe they're not used to working out, and so now they're in pain, but that's just muscle soreness, right? Yeah. So I think sometimes that gets a little bit lost in translation, but it should be more of educating to make sure that whatever that patient is experiencing is within the normal for that time frame. For that injury.
So it's a time frame thing. And I noticed that progression is the thing, not progressing too fast, knowing when to go to the next move.
Yeah, so there are certain procedures, when we talk about surgeries, there's certain restrictions that occur just because you don't want to do anything that's going to jeopardize that surgical graft, right? So if you have your ACL tears, your rotator cuff, that's why you're in a sling for so long, or you're in a brace for so long, because they don't want you to do certain movements. They're going to pull apart what it is that they just repaired.
Sure.
And then once you get past a certain phase, a lot of it becomes what we call criterion based. So it's, if the patient has pain 2 out of 10 or less for 90% of the day, if their range of motion is full, if they can do X, Y, and Z, then we'll move from phase 2 to phase 3. So that's what we call more criterion based. There are averages, like it may take maybe somebody's in phase 2 from week 4 to 6 on average, but that's not going to be the case for everybody.
So it sounds like patience is required.
Right. Patience is required. Absolutely. Absolutely.
And as far as the terrorist comment, I feel like, I'm just curious, like, how does the therapist deal knowing that the person is in pain, but they still have to push through?
I think it's more of understanding that what you're doing is going to help them in the long run. It's interesting because there were certain procedures. I've been a PT now since 2013, so 12 years. And I would say when I first graduated, there were recommendations to for frozen shoulder, for example, it was like push through the frozen shoulder.
I've heard that's really
aggressive.
Hard.
And now the research is saying, no, that's not actually what you want to do. So there are things, again, like this is why things are always changing.
Sure.
But I think as a PT, you just have to be confident in knowing that what you're doing is safe for that person and that it is what should be helping them progress. I really don't like when my patients come back upset or angry or in a lot of pain the next day. So I really try to tailor that to each person. And I think that's something that it's like you can't just like cookie cutter every individual, right? It has to be kind of tailored to them.
How much do you feel like building muscle around those areas? Is that important? Like
Absolutely.
say, like strengthening the quads because you have a knee issue?
Absolutely. So especially as we get older, so things like osteoarthritis, right? That is inevitable and you can slow it down, but it's going to happen, right? So You
For
can't
everyone.
For everyone.
Okay,
yes.
we're all headed that
For
direction.
everyone.
Okay.
We're all gonna end up with there.
Okay.
You cannot regrow that articular cartilage once it's gone.
Okay.
So, staying fit, staying mobile, making sure that your joints are supported by the muscles that are surrounding that joint is only going to help you.
Perfect. So going to the gym. So what tips can you have for people,
Yes.
before they end up at you, after they end up at you, with you, what is the best?
Before, I would say just stay as active as you can, whatever it is you like to do. Some people like to swim. Some people like to do group fitness yoga, like yoga classes, things like that. Whatever it is that keeps you moving, do it. Afterwards, I would say keep up with the things that you learned. I think sometimes people take the exercises they were given for whatever situation that they're in, and they're like, okay, I'm going to do it for my knee, and I'm only going to do it, and then once I'm done, I'm just never going to do it again. And then they might end up back in the same situation. So I think it's a little bit of like making sure that they take what they've learned and they continue to apply it.
I can tell you, it's very difficult when they hand you that sheet. You think you're going to go home and do it. And then you're like, the day gets busy or it's painful and you just don't do it.
Yeah.
So
I
that's
have to
a bad
write
idea.
things in my calendar. If I don't have it in my calendar, it doesn't happen. And I know a lot of patients and other people are like that too. So that's why it's like stay consistent with appointments, but treat it like an appointment, right?
Yeah.
So if you put it in your calendar and you're like, okay, this is on my list for today, this is something I have to do, then I think you're more likely to do it.
Well, it's part of wellness, right?
Yeah.
So overall health and wellness includes doing the thing.
For sure.
Right, so you have to do it.
Or find a buddy and do it with somebody else too.
Well, yeah. So are there anything else you'd like to add or you feel like our audience need to know about wellness, physical therapy, what you're passionate about?
Well, now I'm in education.
Okay.
So I did 10 years in the clinic and I still love the clinic. But now I'm in education. So I think my advice would just be for everybody to keep learning. Like I said, everything's always changing. Don't be scared of your physical therapist. We're here to help, even if it's like a minor thing, right? And once that's done, we're here to help kind of keep people in their game, in their jobs. We want you out of that clinic as fast as you want to be out of that clinic. Trust me. We want you to get back to what you're doing.
Yeah.
We're not trying to keep you there. So that's what I would kind of just focus on the education.
Okay. We have a tradition here at the podcast of picking a card at the end of every session.
Okay.
So if you'll indulge us with this, this is a surrender deck. So the message is for you potentially and for the audience.
Okay.
So if you put your little energy in the deck and just shuffle them, you can hold them.
Okay.
And then you just shuffle them around and then just pull one.
Okay.
And we'll see what our message
do
for
these
today
bend
is.
like playing cards?
Yeah.
They do.
They sure do. If you're good at shuffling. Which is excellent. The last person dropped them on the floor. It's all good.
Was the last person born and raised in Vegas?
You know what? He was,
Oh.
actually.
Okay, and then you just said pick one?
Pick one.
Okay. Okay.
Awesome. Okay, so the message is surrender to the magic of who you are. We all have magic in us. Even in the mundane aspects of life, remember that you are a magical being with a uniqueness and worth that come from just being you. So the message, you are the magic. You are the magic, just be you. So take that throughout your day.
Awesome. Thank you.
Yeah, well, thank you for coming. This is very educational. We appreciate
My pleasure.
it. Yeah.
Of course.